I saw a 55-year-old gentleman, previously healthy, who came to my clinic concerned about a sudden onset of joint pain, muscle aches, and severe debilitating fatigue. I am board certified in family medicine. I am Dr. Jennifer McKenzie, and these are real cases that I've seen in my clinic. So if you want to stay tuned and see what this guy had, how we diagnosed it, how we treated it, and if this could happen to you, then stay tuned. All right, so I saw a healthy 55-year-old male that came in with about a 10-day history of sudden onset, severe fatigue, muscle aches all over, joint pain all over, a little bit of GI disturbances early on in the course, but that had since resolved by the time he had saw me. He denied any fevers, chills, rashes. He does play golf and is frequently outdoors, but otherwise he didn't have a whole lot of notable case history. He had tested negative for COVID, didn't have any other flu-like or respiratory illness symptoms. These were the only ones that were significantly bothersome, but they were quite a change from how he previously had felt. But otherwise, his physical exam was largely unremarkable and didn't really contribute all that much to my differential at this point. I actually did have a differential, and specifically what I already thought it was, but I did want to get some lab tests to confirm and to look for other differentials. If you already have an idea of what this case could be, leave it in the comments below and let me know what kind of tests you would get and how you would treat it if you have an idea. So I did go ahead and get labs. I did actually go ahead and treat him at this point. My suspicions were fairly high. I'm not going to tell you what I treated him with yet because that might give it away, but I will tell you that we got some labs back and it showed generalized increase in kidney function, some liver function elevations. It showed a decrease in white blood cell counts and some new onset anemia. He had actually had labs previously completed a week or two ago, and they were completely normal. So all of these were a change from just even a couple weeks. So we knew that these were new and probably related to his illness. He also had some high inflammatory markers that also signified that something might be going on. I was still waiting for some other send-out tests, but those often take longer to come back for confirmatory diagnoses. So again, if you know what it is at this point, based off of those labs, go ahead and leave it down below. Give me your best guesses. All right, so what did those labs show when they finally came back about a week later? It confirmed my suspicion that he did have anaplasmosis, which is a tick-borne illness. If you remember, I practice here in New Hampshire. We often think of Lyme as a tick-borne illness we have, which is very true. However, babesiosis and anaplasmosis have risen to endemic levels here in New Hampshire, so we can't forget to test for those things, look for those things, and identify them when needed. I did start him on the appropriate treatment at the visit, which was doxycycline 100 milligrams twice a day for 10 days. And when I got the labs back, he had very classic findings of anaplasmosis. Some people don't have all those findings, but when I saw that his white count was down, his kidney function and liver functions were up, and he had new onset anemia, I was nearly 100% certain that that was the correct treatment. The treatment does go ahead and treat for both Lyme and anaplasmosis, so I covered both of them with that one treatment, and if he came back for babesiosis later, I could treat that later. However, people can get quite sick very quickly with anaplasmosis or Lyme, so we know that treatment outcomes are better if you start it early, so I went ahead and started it at that visit. So this is a pretty interesting case. He had a full recovery after the 10 days of antibiotics. He did great and is feeling great now. So overall, don't forget about ticks. Most places in the country have different types of ticks, and they can all carry different types of tick-borne illnesses specific to that area. So if you are out, make sure you're wearing protective clothing, bug sprays, try to avoid heavily wooded areas during peak seasons. These can all help prevent tick-borne illnesses. We gotta all keep them on our radar to stay healthy and happy. This wraps up the end of this series, but stay tuned if you're interested in hearing about more cases that I see in my clinic. Stay happy, stay healthy.